Welcome back, everyone. We've got a really interesting deep dive teed up for today. You guys sent in some fascinating articles and research on healthcare in Telangana, India. And, well, looking at it all, it seems like we're dealing with a bit of a paradox.
Yeah, definitely a paradox. You see this booming private healthcare sector, especially in Hyderabad, drawing in medical tourists from all over the world. But then at the same time, you have these stark contrasts in the rural areas where access and affordability are just major hurdles.
Right, it's almost like two different healthcare realities existing side by side. One of the articles you sent really caught my eye, talking about the lack of maternal care centers in some of the tribal regions, like Adilabad and Bhadradri Kothagudem. Can you tell us a bit more about what's happening in those areas?
Absolutely. Those districts, and you can add Asifabad to that list, they face a really severe shortage of specialists. So for expectant mothers, just getting quality care during pregnancy and childbirth, well, it becomes incredibly difficult. And it's not just limited to maternal care, it's across the board. Basic healthcare services are often lacking, and if you need to see a specialist, you're often looking at traveling long distances, which just isn't feasible for a lot of people.
It's a tough situation, especially when you consider that Telangana is making headlines for its advances in specialized treatments and those high-tech hospitals. Such a stark contrast. But I'm also seeing a lot about government initiatives trying to bridge this gap.
Yes, the Telangana government has been quite proactive, I'd say, in this area. They've rolled out several programs, some of which have actually earned global recognition.
Okay, so let's dig into those programs. You mentioned Aarogyasri in your notes. I have to admit, I'm not familiar with it, but it's described as a real game changer. What is it about this program that makes it so impactful?
Well, for one thing, Aarogyasri offers free healthcare to low-income groups, and it covers a really wide range of tertiary care services. What's really impressive is the scope of it. They cover major surgeries, cancer treatment, critical care, the kind of procedures that would normally be financially devastating for a lot of families.
Wow, so it's not just about basic checkups. We're talking about providing access to life-saving treatments. That's pretty incredible. I also see you highlighted Kanti Velugu. What's special about that one?
Kati Velugu is actually recognized as the world's largest free eye screening program. Since it launched back in 2018, they've screened millions, provided glasses, and even performed surgeries, all free of charge. It's a major step towards tackling preventable blindness. That is a big issue in India.
It seems like Telangana is really going big with these initiatives, and from what I'm seeing in your research, it's not just focused on rural areas. Can you talk about Basti Dawakhanas?
The Basti Dawakhanas are an interesting take on urban healthcare. Basically, they're small clinics, over 350 of them, and they're set up right within communities, mainly in Hyderabad and some other major cities. So it's taking healthcare directly to the people, getting rid of those barriers like transportation costs and distance.
Okay, bringing healthcare to where people live, whether it's a village or a busy city. I'm also seeing the Telangana Diagnostics hub and spoke model mentioned. What's that about?
This one is all about decentralizing those diagnostic services. The idea is that instead of everyone needing to go to major hospitals in Hyderabad for tests, they're setting up these diagnostic centers in more locations. So the goal is to take some pressure off the tertiary hospitals and make testing way more accessible.
All right, so it's a multi-pronged approach to address these disparities. They're tackling it from various angles: financial help, specific programs, even restructuring how they deliver services. But the question is, are all these initiatives enough to really get over these deep-rooted challenges facing healthcare in Telangana?
That's the million-dollar question. The government is taking action, that's clear. But the issues are incredibly complex. There's definitely more to unpack, particularly when it comes to those challenges in rural areas.
Right, and we've touched on the lack of specialists in rural areas, but I'm curious about the actual facilities themselves. Is it just a matter of having enough doctors, or is there something more to it?
The infrastructure itself is a huge challenge. A lot of rural healthcare centers just don't have the equipment and resources you'd find in a private hospital in Hyderabad. And that creates a sort of vicious cycle where
Where doctors don't want to work in places with limited facilities, which just makes the shortage worse and limits the options for those communities even further.
exactly, it all ties together. And then you add the financial burden on patients, and it becomes even more complicated. Even if someone can make it to a private hospital in Hyderabad, the costs can be just astronomical.
You made that point in your notes, and it really hit home. You said that for a lot of locals, even those considered middle class, private healthcare is just not an option. That's a really harsh reality. And we haven't even touched on the growing problem of those non-communicable diseases, the NCDs, things like diabetes and heart disease, all those conditions that are on the rise because of lifestyle changes. Feels like we're barely scratching the surface here.
We are. And it's crucial to remember that these challenges are all interconnected. The lack of good facilities impacts how many specialists are available, which in turn affects the quality of care and drives up costs.
Like this intricate web. Definitely a lot more to explore. But before we dive into those specifics, I think we need to talk about the role of private healthcare in all of this. You've got some interesting thoughts on that, and I think it's a key part of this conversation.
It is. Private healthcare in Telangana. It's like a double-edged sword. You've got this medical tourism boom attracting international investment. But then you have this other side, where it raises questions about accessibility and affordability for the people who actually live there. No easy answers with this one.
Okay, so private healthcare, you called it a double-edged sword. What did you mean by that?
Well, you've got these world-class hospitals in Hyderabad drawing patients from all over the globe, coming for those specialized treatments. That's huge for the state's economy and its image as a medical hub.
Yeah, I remember that article you sent about Hyderabad's medical tourism industry. Pretty impressive stuff. But what about the average person in Telangana? How does all this impact them?
That's the other edge of the sword. You have these advanced facilities attracting all these international patients, but they're often way out of reach for many locals. And I'm not even talking about low-income folks.
So it's like this strange situation where Telangana is getting known for these cutting-edge healthcare advancements, but a good chunk of its own people can't even afford them.
Exactly. And that brings up some really important questions about fairness and access. Is healthcare a right or a privilege? Should your ability to get quality care depend on how much money you have?
Tough questions. And it's something that keeps coming up in all this research. One article mentioned those high out-of-pocket expenses in private hospitals, even for routine stuff.
Yeah, that's a major concern. You have this lack of price transparency and the potential for overcharging. It just makes the affordability issue even worse. It's a complicated problem, needs a multi-pronged approach.
So what can be done? You mentioned public-private partnerships, the PPPs. How could those help bridge this gap?
PPPs, they could be a real game changer. Instead of seeing the private sector as this totally separate entity, the government could work with private hospitals to expand their reach into the areas that need it most.
I see. So it's about using the expertise and resources of the private sector, but making sure that healthcare is reaching those who might otherwise be left out. Can you give us some specific examples? How would this actually work?
Sure. Imagine a private hospital chain partnering with the government to set up a specialized clinic in a rural area. The government could offer financial incentives, maybe subsidies, while the private hospital brings its expertise in technology.
Interesting. So instead of building all new government facilities, they're tapping into existing infrastructure and expertise. Are there other ways PPPs could be used?
Definitely. They could collaborate on things like ambulance services, making sure response times are quicker in those remote areas. Or maybe a private lab company could set up a branch in a rural town, and the government could help subsidize the costs to keep those diagnostic tests affordable for locals.
Okay, so PPPs could help expand access and bring those specialized services to areas that are underserved. But what about the cost issue? How do we make sure private healthcare is affordable for more people?
You're right. Cost is crucial. This is where government policies come in. Price regulation is one option, where the government sets limits on how much can be charged for certain procedures or medications.
Makes sense, especially for those essential procedures. But wouldn't that discourage private investment?
Not necessarily. There are ways to balance things out. Another approach is to focus on transparency in billing.
Right, so patients know exactly what they're paying for and can compare costs. Transparency could prevent overcharging and give people the information they need to make informed decisions about their healthcare.
Exactly. And we shouldn't forget about technology and its potential. Telemedicine, for example, has huge potential to connect those urban specialists with rural patients.
Oh, that's a good point. I was reading about a pilot program using those teleconsultations for dermatology in some remote villages. Seemed pretty promising. But is technology really accessible enough in those areas to make a real difference?
That's a valid point, and it's something the government is working on. Improving internet connectivity in rural areas is essential, not just for telemedicine, but for education, economic development, even just overall quality of life.
Sounds like a big investment in infrastructure.
It is, but the potential benefits are huge. Think about a rural healthcare center that's equipped with telemedicine tech They can consult with specialists in Hyderabad, get expert opinions, and potentially avoid those costly and time-consuming trips to the city.
That would be a game changer, especially for people with chronic conditions who need that regular monitoring. And from what I'm seeing, technology isn't just about connecting doctors and patients, it's being used in diagnostics too.
Definitely. Artificial intelligence is being used to analyze medical images and data. That can be a huge help in areas where there's a shortage of specialists.
So PPPs, policy changes, and technology, they could all play a part in shaping the future of healthcare in Telangana. It's exciting, but also really complex.
It is. It needs careful planning, strategic investment, and a commitment to ensuring everyone has equal access. But the potential is there to create a system that truly serves the needs of all its people.
We've covered a lot, from government programs and the private sector to the possibilities of technology. But before we wrap things up, I want to talk about some concrete policy recommendations. We've touched on some ideas, but what are some specific steps that could be taken to move forward?
One key area is expanding programs like Aarogyasri so they cover more people. Right now, it's mainly for low-income groups. But what if it included middle-income families, too?
That would be huge, making quality healthcare more affordable.
I'm looking at some of your research here, and one report suggests that even a small expansion of Aarogyasri could really reduce the financial burden on families who are struggling with medical expenses.
Exactly. It's about finding ways to ease that financial strain so people can focus on their health, not on worrying about bills.
And along with financial assistance, I imagine investing in rural infrastructure is also crucial. Absolutely. Upgrading those primary health centers and district hospitals so they're on par with the private sector, that's essential. That means better equipment, attracting and keeping qualified staff, and creating a better environment for healthcare workers in those rural areas.
So it's not just about new buildings, it's about creating a system where people feel confident getting care in their own communities. And going back to that shortage of specialists in rural areas, what can be done about that?
It's tough, but there were some interesting ideas out there. One is creating incentives for specialists to work in rural areas, things like loan forgiveness programs, housing subsidies, maybe even higher salaries.
So make it more attractive to work in those rural areas, both financially and professionally. And besides attracting specialists, I imagine there's also a need to invest in training and development for the healthcare workers who are already there.
Absolutely. Providing opportunities for continuing education, upskilling, and professional development can empower those rural healthcare workers to provide more services and improve the overall quality of care.
Okay, so a multi-pronged approach. Financial assistance, better infrastructure, and a focus on training and development. It sounds like a comprehensive plan, but is it really enough to address all those deep-seated issues in Telangana's healthcare system?
It's a good start, but there are other things to consider. Addressing social determinants of health, promoting preventative healthcare, and tackling that rising burden of non-communicable diseases, those are all pieces of the puzzle.
You mentioned those non-communicable diseases, the NCDs, earlier. We haven't really talked about that yet. Can you tell us more about how those NCDs are impacting the healthcare system?
NCDs, things like diabetes, heart disease, cancer, they're all on the rise in Telangana, just like in a lot of other places. This puts a huge strain on resources, both in terms of treatment costs and the demand for specialized care.
Right, and I remember reading about that link between air pollution in Hyderabad and respiratory problems. Seems like environmental factors play a role, too.
They do. And addressing those factors requires a broader approach. It's not just the healthcare system, it's also environmental agencies, urban planners, even transportation authorities.
It's about looking beyond just the hospitals and tackling those root causes of health issues. So it's not just about treating diseases, it's about preventing them in the first place.
Exactly. That's where those public health initiatives come in. Investing in programs that promote healthy lifestyles, raise awareness about disease prevention, and address those environmental risks, those can have a big impact on the overall health of the population.
So it's about shifting from a reactive approach to a more proactive and preventative one.
That's the goal. Creating a culture of health and well-being, empowering individuals to take charge of their own health and make those informed choices.
And that takes education, awareness, and access to the right resources. A multifaceted challenge for sure, but the potential rewards are huge. We're not just talking about better healthcare, we're talking about better lives.
Absolutely. It's about creating a society where everyone has the chance to live a long, healthy, and fulfilling life. That's something worth striving for.
Well said. We've covered a lot of ground, but we've only scratched the surface. There's so much more to explore, the details of specific government programs, the role of technology. But before we go too far, I think it's time to bring you into the conversation, our listener. We've been looking at your research, talking about the complexities of Telangana's healthcare system and discussing those potential solutions. But now we want to hear from you. What are your thoughts? We've talked about Telangana's healthcare, this kind of almost contradiction, right? You've got this booming medical tourism industry, but then the struggles of so many in the rural communities. We've explored some potential solutions to everything from expanding those government programs to leveraging tech and those private partnerships. But now I'm curious, what really jumped out at YU from all this research? What gives you hope for the future of healthcare in Telangana?
Honestly, it's that determination to make things better. Think about Kanti Velugu, providing free eye care to millions of people. That's a massive undertaking. It takes real commitment to public health to pull that off.
That's true. And it's not just Kanti Velugu. Telangana seems to be a real hub for innovation in healthcare delivery. The Basti Dawakhanas, taking healthcare right into city neighborhoods, that's outside-the-box thinking.
Exactly. And the diagnostics hub-and-spoke model, that's such a smart way to make testing more accessible without completely overwhelming those big tertiary hospitals. They're coming up with clever solutions that are tailored to the specific needs of the people.
So there's this willingness to experiment, to try new approaches, and that gives me hope. Because with these complex issues, there's no magic bullet, no one-size-fits-all solution.
Absolutely. And that's where that collaboration between the government, the private sector, and the communities themselves becomes so vital. It's all about striking that balance, using each other's strengths to build a system that works for everyone.
I was particularly interested in that discussion about public-private partnerships. Seems like there's a lot of potential there that we haven't fully tapped into.
I agree. If they're done right, PPPs can bring those much-needed resources and expertise to the areas that really need them. Imagine a private hospital setting up a specialized cancer treatment center in a rural district with support from the government and the local community.
That would be incredible. Bringing that specialized care closer to home, cutting down on travel time and costs for patients. A win-win situation for sure. But we also can't forget about the elephant in the room, affordability.
Absolutely. Cost is a huge barrier for so many people. Expanding programs like Aarogyasri to include middle-income families would make a world of difference. And then regulating prices, making sure there's transparency in how things are billed, those are essential steps. We have to make sure healthcare doesn't become something only the wealthy can afford.
Looking back at the research, what other policy recommendations stood out to you?
One report emphasized investing in training and development for those rural healthcare workers. Giving them the skills and knowledge to handle a wider range of cases could mean less reliance on specialists from the cities.
Right. Empowering those local healthcare providers to deliver quality care, that's a sustainable solution. And technology seems like it has a huge role to play as well.
It does. Telemedicine can connect those rural patients with specialists in Hyderabad, offering expert advice without the need for travel. And AI can be used to analyze medical images, making diagnosis faster and more efficient.
So we're looking at a future where technology can help bridge those gaps in healthcare, both geographic and economic. It's pretty exciting. But then there's also the challenge of those non-communicable diseases.
Yeah, that increase in diabetes, heart disease, and other NCDs is a big concern. It calls for a real shift towards preventative care, promoting healthier lifestyles, and tackling those environmental factors like air pollution.
So it's not just about treating people when they're sick. It's about building a healthier society from the ground up. It's a big task, but it feels like Telangana's headed in the right direction.
I think so too. There's this sense of momentum, a real drive to find innovative solutions. Telangana has the potential to be a model for other places facing similar challenges.
As we wrap up this deep dive into Telangana's healthcare system, I'm cautiously optimistic. Clearly, the challenges are huge, but there's a strong determination to overcome them.
And that's what we need to remember. The future of healthcare in Telangana depends on collaboration, innovative thinking, and putting people first.
Well said. And to our listener, we hope this deep dive has given you a better understanding of this complex issue. It's been a fascinating journey, and we're eager to see what the future holds.
Thanks for joining us on this exploration. It's been a really thought-provoking discussion, and we hope you've gained some new insights. And maybe, just maybe, a renewed sense of hope for a healthier future for everyone.